Sarah? You're Sarah. Right? So yeah, Sarah's quite mobile. I mean, that's quite mobile right there, right? So she's one that's gonna be difficult because my old way of doing things was that I would flex the person and then rotate them. Okay, and that's going with the normal coupling behavior, right, of the facet joint. So I'm even, you know, I'm not helping myself in terms of trying to manipulate her. So with Sarah, I really want to try to keep it in extension as much as I can, and I may even go up in terms of keeping you extended up here. And just relax.
Mama, can you talk to her position again, please?
So what I'm doing now?
No, for the hypermobile, you putting her.
Yeah, so I want to keep her into neutral or extended position up top, right? And so we know when the lumbar spine is an extension, the normal facet joint is opposite. Side bending and rotation occur opposite. Going against that is going to lock up those facets. So I want to go side bend and rotation towards. So she's already in extension and already side bent to the right. So I'm going to rotate, or side bend to the left, so I'm going to rotate her left. That's all I need to do is just rotate her in this position.
How are you rotating?
So how I'm going to rotate her. You okay? I'm kidding when you're hypermobile. Straighten my back. So I may even, sometimes we talk about, you know, putting her in neutral or flexion. I may try to keep her even from the top, put her into a bit of an extension position, because that may help me also. All right, so to keep her in an extended position, I'm going to grab her arm, and I'm going to come up top. So as I rotate her, I can keep her in extension, and I'm going to rotate her till I start feeling some movement occurring there, and that's where I'm going to stop. Okay? Then have you hold here. So now I'm going to see, what did that do? Did that help with me? Yeah, a little bit. She cinched up. See how? Yeah? Before her shoulder was going all the way down. Now I can, you know, at least create a barrier, because that's what I want to do. Okay? You okay? And she's like closing her eyes. You okay?
Yeah. So you do the little ones and then the big ones.
So what I do usually with that, although I didn't ask her, is usually I'll just see how comfortable they are before I go. Are you comfortable? Any pain? Any symptoms? What's happening? No, I'm good. Comfortable? Yeah, that feels okay. And then a quick thrust. Now, I want you to guys come around here again, because you guys need to look at my body position, because that's the key here to do this well. And so I want you to set up, and I want you to feel it, maybe not thrust it. And when you feel like you're ready to thrust, let me come around, let me see how it looks. Okay? Again, my ASIS is on her ASIS. I'm facing kind of up a little bit more in this direction. I'm rolling her pelvis towards me, so now I've got a bit of an angle. It's not up here. If I try to manipulate here, nothing's going to happen. I need this leverage to get that rotation there.
Do you bring them to end range before you thrust?
Yep. So I'm taking her to her end range and then
thrust. Okay.
Yep. So I'm taking her in and then thrust. And so when I take her, look at my feet. My left foot is forward. I'm on my toe, and it's a drop. It's a drop from my body. I'm dropping. Okay? So you're taking, and then it's just a quick drop. So you guys kneel down. Do a kneel. Bring one foot forward. And drop. Drop. Faster. Drop. Seriously. No, you got to drop quicker than that. Drop. You can't do this. That's not going to happen.
not putting more force in just your arm alone, it's your whole body.
It's my whole body. I'm dropping with my whole body. I'm keeping this all tight, and I drop.
Okay.
And you're stabilizing the spinous process with the hand.
I'm trying to.
Okay.
Now with Stacy? Sarah! I am the worst. I'm going to fail at the end of the semester. Yeah. Now with Sarah, I got like, it felt like it was like almost like 3. Like a little zipper. And you know, this goes to the question what I said in lecture, you know, how exact are we in specific? Probably not very, I mean, the literature proves otherwise. We're not very specific. We're not very specific. And the reason why I'll do a manipulation is because I want the audible pop. I will be honest with you. I do.
Is there been shown that if you have an audible, it's better?
Has there? I don't know. I don't think so. I don't think so. But to the patient, it's a huge difference. You didn't quite get it. Yeah, it didn't quite. Yeah, you didn't quite do it. But you might have done it right. Everything might have been perfect. Everything might have been there. But
Just show us how your position where she was hypo.
all right, who's hypo?
Jess.
Jess was. You were sort of hypo, not quite hypo. Who else is hypo?
I think I am.
Not
Hypo. Right.
I think.
Grab a pillow. So let's say we just slide down towards me. So usually I'll start here and kind of test it and see. So she's kind of in an extended side bend.
No.
So when you were doing that, I felt like my thoracic was moving, whereas I didn't feel like I
your
had any
lumbar?
movement in
Yeah.
my lumbar.
But I want to, where I'm locking you up is your thoracic and all the way down. So I'm looking for general hypo versus maybe lumbar hypo, because this is where I'm gonna kind of lock her down. Yeah. Because with her, if I try to go into flexion, so let's say, okay, so let's say she was hypo up in here, and then I'll let it go. Okay. So what I'll do is I'll flex her and rotate her up. I mean, I got it's too much. She's got too much mode. I mean, she's gonna feel very wound up. It's not gonna work in your head. It's all crooked. It's besides the matter. But with her, so you stay on your side. Stay on your right side. If I keep her in an extended position and keep her there, lock her up top, now at least I got some barrier to work with.
So can we use the same principle for the 3s and 4s when we get them into that position?
You can,
Because there
sure.
are some, like,